In this tutorial, I'd like to talk about how to work with Alginate effectively so that we get maximum time without distortion with this material. Alginate is a very good impression material for a lot of purposes in dentistry, but it does distort in time. So we want to maximise the time, and that starts really with the taking of the impression. One of the things that I see quite often is that impressions are taken where there is a lot of alginate that is freestanding. So to get your alginate to travel well and to last a long time, if there's a gap between when you take it and pour the model up, we need to make sure that that alginate is supported, and we do that by making sure that the tray that we have is supporting the alginate. The way we can do that is to make sure that we try the tray into the patient and make sure that it fits exactly. If there are areas where the tray is overextended, then we can either adjust it with our handpiece or we can take a flame and adjust. So the new disposable trays are very good for this. So I quite often will find that with an upper tray, we might have interference in the tuberosity area around the molars. I simply take the flame, rather than choosing an extra size in the tray, I take a flame and warm it up in this area, and then I can flex the tray out and then let it set in a new position before we take the impression. We can do that on both sides, and then we can put our periphery wax around the tray, and that also helps us contain the alginate and keep it supported. Once we've done that and adjusted the tray and tried it in to suit the patient, we're then going to make sure that when we put adhesive on, that the adhesive covers the inside of the tray and any periphery wax that we put on there, because otherwise what's going to happen is the alginate will lift off that periphery wax and we'll get a distorted area. With mouth guards and so on, it's most important that we have this area where we can extend to improve the protection for the patient. Okay, so that's the first thing, is to make sure that your alginate is supported. And then the second thing is to make sure that when we're taking the impression, we position our tray correctly so we don't have thin to thick areas in the alginate. So once we've taken our impressions, and you can see that these impressions have got good extension and the trays are supporting the impression quite well, how do we treat it from there? Do we take it to the sterilising solution? What we must do with alginate is remember that it absorbs moisture. So if we're taking it to the sterilising solution and placing it, we must work with the specifications that are given for the maximum time or the minimum time to allow alginate to soak in our sterilising agents. And it's best, if you get the chance to select agents, to select the sterilising bath that is going to keep the alginate for the smallest amount of time. Sometimes it's even better to dip the alginates and then place them in a sealed plastic bag rather than have them soaking for long periods of time if you're going to be dealing with other patients and you're not going to be able to work to the timer. So it's very crucial that we don't soak the alginates for too long, because they will take on moisture and we'll get a distorted impression and then hence a distorted model and ill-fitting appliances. Okay, once we have had the alginate in the bath for the desired period of time, the way we're going to treat it is to remove it from the bath, flicking out the excess, and then we're going to look at this surface here and see if there's anything above the tray that's going to travel. It's going to push it up during travel and distort the impression. And in this case, there's a little bit there, but it's in quite a thick area, so I think that that's going to travel quite well like that, and the same with the upper impression. But if we have areas that are out like this where pressure might distort during a travelling time, we're going to take a sharp knife and we're going to reduce those areas to minimise that effect, provided the area that we're trimming off is not required for the appliance that we're going to be fabricating. So we'll take that off, and in this case there's a little bit here that could come off that might distort if pressure is put on that in the packaging. And that area that I talked about right there, we're just going to take that off, because you can see already that that could move and distort this area here, and we'd have premature contact on that molar area. Okay, so once we've done that, what we need to do is understand that alginate does not need to have water sitting inside. So we're going to make sure that any moisture is flicked out of the alginate, so it's moist but not holding any moisture in puddles in the teeth. You can see that nice wet surface. Then we're going to place it in a Ziploc bag, and we're going to place it with the tray supporting the impression and no pressure on the top here. We're going to do exactly the same with this one. Remove any of the excess moisture from it. You can see that it is damp, but no water sitting in the teeth or in any other part of the impression. And in a similar fashion, we're going to put this into here so that it's supported on the impression and we're not going to get any distortion. Then make sure that there's minimal air in there, and we're going to seal that bag up nicely. So now we have a moist atmosphere inside the bag, but no residual water. There is no need for us to have any wet cloth to maintain that moisture, that moist atmosphere. It will maintain, if you have a reasonably close fitting bag like that, it will maintain the moisture. So the last thing is that we're going to now sit this into a container that protects this. So we use our typical disposable containers. Arranging these so that they are not pressing on each other is crucial. So there's no pressure down on the periphery areas or on the palate. And then we place a lid on that to protect it, and that's how your alginate should be transported. If we do it in this fashion, we're going to end up with a 72-hour time lag before we see any significant distortion in alginate. So the research shows that we can successfully have 72 hours without distortion with alginate if we treat it in this fashion. The last thing that we must emphasize is that you do not refrigerate alginate. It must be kept at room temperature. So if the temptation is to put it into a fridge, if the moisture happens to lower the temperature enough, then if it freezes, it will cause the alginate to change its dimension and it won't be accurate again. Equally, if you put it on the dashboard of your car and it's overheated, we're going to have the same problem. So keep it at room temperature only, not refrigerated, not in a hot area, and with no pressure on the alginate, and then we'll be guaranteed to get the very best possibility of having a close fitting appliance. Thank you.